hello, health heads. Welcome and thank you for checking in to this dose of the healthcare uprising. I'm your producer over here, Jeremy Carr, along with your host over there, Heather Pierce. And what's on our agenda for today, Heather? I haven't done one of these in a while. Did I do that right?
Yeah, you're good.
Good. What's on our agenda for today, Heather?
Today we have two of the co-founders of Philly Healthcare's, Dr. Carrie Krauss and Dr. Mark Alsthuler. They are both in the Philly area, both physicians. He's a primary care doctor. She's an OBGYN. Philly Healthcare's was basically, it's a 501c3. They basically came together in response to some of the, we'll just say the Trump administration, executive orders, things of that nature that are creating somewhat untenable circumstances, particularly for our immigrant population and other marginalized communities like LGBTQ, et cetera. And really their goal is to eliminate barriers to healthcare through advocacy, education, and awareness. And they've created this really great network of providers that serve these populations. We're going to learn all about what they do in this space and why they are so amazing. So there you go.
Very knowledge is power kind of episode.
Very much.
And they're setting a formula or figuring out a formula that could go everywhere with this eventually. So I really enjoyed this conversation. So without further ado, let's get into our conversation with Dr. Carrie Krauss and Mark Altschuler from Philly Healthcare's.
Hi, and welcome to the Healthcare Uprising podcast. Today we have Mark Alsthuler and Dr. Carrie Krauss with Philly Healthcare's. Welcome to the show, Mark and Carrie.
Thanks so much. Thank you for having us.
Yeah, great.
And welcome back, Carrie.
And yeah, that's right.
Returning guest again.
We do. Dr. Carrie Krauss, we have had her on the show, gosh, when we were babies. So just over a year
still
ago.
Had the blue wall behind us, figured out.
Yeah. So we've
that's like first dozen episodes.
We've grown up a little bit, and so was very excited to see and hear about the Philly Healthcare's organization, thanks to the power of LinkedIn. So really excited to have you guys here today. So let's just start at the beginning. Tell us what is happening in this world that made you decide and create Philly Healthcare's at this point. And I don't know,
what
Mark,
is Philly Healthcare?
And what is it? Mark, do you want to kick that off?
Sure, I'd love to. Thank you once again for having me. Hopefully one day I'll catch up to the number of episodes that Carrie has had on the show. So So I'm a physician in Philadelphia, have been practicing for over 20 years. And the focus of my work has primarily been in providing care to the refugee and immigrant community here. And in early 2025, there were a number of new presidential orders that came out that were, targeting a number of the populations that I have primarily been taking care of, including the immigrant community. So myself and two others who are, I would say, also, leaders in the city in terms of immigrant health, quickly got on the phone to say, what are you doing? How can we protect our patients? And I also think because we've been doing this for a while, we had other colleagues also reach out to us to say, hey, what can we do to help? And we realized that in the moment, we had to do something, and we couldn't just stand by the sidelines while some of this was happening. We felt obligated as healthcare providers that we had to do anything in our power to protect our patients. But we also needed to bring people together and kind of support everyone else's work. So literally within the week of these orders coming out, we said, well, let's get together, let's bring a few physicians in that we know and figure out what needs to be done. And really in the early few days to weeks, it was really just bringing people together, getting some ideas, and kind of pivoting to what we were seeing on the national level. And we knew that when we initially created the group, we thought about a few kind of big bucket areas that we wanted to create. We wanted to have a safe space for people to get together. Primarily, initially, it was really just healthcare providers, but it's certainly grown as a safe space for us to talk about what's going on and how we can help. We wanted to use our voice and our platform as healthcare providers to advocate for our patients. And we wanted to figure out how we could create materials that could provide information and education to healthcare providers, to community agencies, to our community, just to give them the most up-to-date information to protect themselves. And that was the beginning of Philly Healthcares. And once Carrie joined, it was like we were cruising, because she kind of joined and we had some connections prior, some through our healthcare positions. And she's really done an amazing role kind of taking on that education piece and designing our website, which has really been instrumental in kind of housing all the up-to-date information that we need.
Great. Yeah, which was my next question was going to be, how did you get involved? How did you show up, Carrie?
So kind of, another crazy social media type story. I'm in the same Facebook group there, women right now, especially millennial women in their Facebook groups is like a big thing. I'm in all these like Philly physician moms group, and I'm in an obstetrician moms group. So I'm an obstetrician by training, but I think it was actually through the Philly physician moms group that I saw one of our co-founders, Maura Salmon, post about a group of healthcare providers coming together to, excuse me, help figure out how we are going to care for patients given this new world order and all these executive orders that were coming out. I think there was not only concern about the immigrant population, but about reproductive health care and how that was going to change going forward, and access to contraception. I think also a lot of LGBTQ care. So it really, like, even though maybe the immigrant population and refugees, certainly that was maybe the most impacted, there was also still concerns about all these other, like how are we going to care for patients? And then at a baseline level, which I know you guys appreciate, just what we've been dealing with since COVID and the healthcare system in general. It's just, I think a lot of us felt motivated by, like, how are we really going to provide care to patients moving forward, given everything that's happening in this world right now? And I know I was feeling helpless and feeling, what can I do constructive? I'm feeling scared, feeling uncertain about what's to come, not only for me, but for my patients. And I think when I saw Maura's message about if anyone is interested in joining this group that's brainstorming ways to help, I said, well, okay, I'm not going to sit here in my fear and just stew by myself, because that doesn't really accomplish anything. Let me reach out and join this organization. And I think, and I've done things like this in the past and gotten involved in different efforts. But I think what was really impressive about the Philly Healthcares movement is, first of all, you have 3 co-founders and leaders who are like, Cheryl Bedigal is the former health commissioner of Philadelphia. So she's like really just extremely well known. I think both Mark,
is she
Cheryl,
one of the co-founders?
Yes, she is.
Okay.
So again, has extensive experience helping to lead the city of Philadelphia as far as access to healthcare. Mark running a refugee clinic that's, I think, one of the largest in Philadelphia. Correct me if I'm wrong, Mark. And then Maura Salmon, who was one of the early, when there was Operation Allies Welcome, which is it was a massive influx of Afghan refugees. She, Mark, and Cheryl, I believe, helped coordinate that effort. And so you've had these people who have done big things in the city in the past, know how to get stuff done. I mean, it was a very, like, as Mark said, we were still trying to figure out exactly what our mission was and how we could help in the beginning. But once we figured that out, it was like, okay, we're doing this, we're building a website, we're going to disseminate information, because I think that's one of the most critical antidotes to fear, right? Is like you get information, you get like, okay, what's actually happening, what's actually happening with Medicaid benefits, with SNAP benefits, like all of this stuff. There's a role that can act even outside of the existing systems to raise awareness through social media. Like, that's not something that all the health systems were doing, or the, even health department at that time. So that was something that we could say, okay, we can be that channel. We can be that, like, voice on Instagram or on TikTok, even, that is getting information about, here's how you access your SNAP benefits. So I think that was, and I've always been super, super passionate about education being a major power in healthcare. In fact, I think it's foundational. So I think it was a
Agreed.
natural role for me to come in, and say, okay, how can we use different tools to help keep patients informed about what's going on and keep other doctors informed about what resources their patients have in a very dynamic time.
So
and
what can you do for someone if they've basically illegalized their healthcare though? I mean, how far? I mean, you can only do so much in some of these situations, I guess, right? And
Yeah.
I mean, I have so many specific things I would love to ask about. There's like a jumble in my brain right now. But like with the migrants and the women's rights and like, there's so many things. Like, how do you even
It's a
cover
lot
it
to
all?
tackle. Yeah.
But like, can you give me some like hard examples of things you do in real time?
Mark, I'll shoot this one over to you. You're probably the answer.
Well, so I mean, so I was saying, for the record, Carrie and I did not meet on a Facebook mom group. I've known Carrie outside of that, so I was not privy to the mom group. And I mean, I think sometimes, it's like when we first started this, similar to, honestly, so when I first started doing refugee work in 2007, I didn't really know what I was doing, but my goal was to, okay, I may not know how to swim, but I can jump on the water and keep my head above water and figure it out along the way. And that's kind of what we were doing with Philly Healthcare's, because the information and the changes that were happening were so quick that you were pivoting every single moment. And honestly, to this day, we're continuing to do that. But we have a lot of people in the water who are all holding each other's heads up and figuring out how to do this together. And while I agree that, at times it feels like the Wild West, there are still rules and there are laws. And for me, I feel like the best offense is a good defense, right? So for an example, providing, some physicians and healthcare providers may be working in large institutions where they have access to a legal team, they have access to a lot of resources, so that if any questions came up, they have people to go out to. But there's a lot of people who don't, right? So, we provided education to healthcare providers to understand the rules of where patients are protected and where they're not protected in a healthcare facility. Historically, a waiting room was a protected space and a safe space. It's no longer a safe space.
Is that
A
right?
patient
Really?
Yes. Houses of worship are no longer safe spaces.
No kidding. I didn't know that.
Wow.
Yeah. So that is a new change. But if a patient is in a patient exam room, then, and behind a closed door, that is a private space. And, a federal agent can only go in there if they have a federal warrant for that person signed by a federal judge. These are not things that Carrie and I learned in med school, right? Or along the way, but these are things
we're
that
all
we
learning
learned,
about that stuff right now.
right?
Yeah.
And then we've then tried to use that to educate others. How can you, if you're a smaller practice, how can you potentially make some changes to your practice and adapt to make it safer for your patients? So if you know that information, maybe you have ways to bring people through your waiting room a lot quicker, because then once they're in the exam rooms, there's another layer of protection that they don't have when they're in the waiting room. As an example, right? And then, early on, I was told about an app that our patients can download that will basically, it was a very simple app, but it was a know your rights app. And regardless of whether or not, for many of them, English is not their primary language, but that app, if they were to get stopped, that app would allow them to say what their rights were in English, as well as translating it to them so that they knew what was being said. And the app also would send a text message to a family member in case they were taken away. So, these are some small little examples. I mean, there's now probably hundreds of examples. And, so when we thought about the website, which really Carrie has built and created and mastered, it was taking all of these pieces of information that we could then use that could educate a number of different people. Once again, it was not only for the providers, it was for, anyone who had any kind of point of contact with any of the communities that were being targeted, as Carrie told. And we're continuing to, adopt the information that we have. And, as we'll talk about probably later, we've started to have webinars as another format to provide education. So I could keep going on, but Carrie, why don't I turn it over to you to answer whatever I forgot?
And we will talk about the webinars too.
Yeah,
we'll get
definitely. There. I think one of my early sort of aha moments when we started Philly Healthcares was realizing the importance of community outreach to the healthcare providers. I think that's sort of one of the foundational principles. Like we very quickly amassed, I think, because of the moment and everyone sort of feeling the same way of needing to do something. Like I think early on we were around like 120 to 150 members, like healthcare providers primarily. Again, some other healthcare adjacent folks, but it was a really very immediate response of like, okay, let's come together and let's do something. I think we definitely wanted to start with education, but I think it was very clear that we also needed that outreach piece, that we wanted to not just create new materials or, create new resources, especially if those resources already existed, but that maybe it was being that bridge connecting like organizations that are already doing legal services for immigrants or, providing access to abortion services or contraception or, LGBTQ care. It was about being that bridge that isn't always there in other aspects. And I think also because we had this large community, that we basically have like a large Signal group. I guess if you're familiar with the app Signal, it's like secure texting.
I wasn't until last year, to be perfectly honest.
All learning about that.
Well, it turns out if you add the wrong person, that person will get that text. But anyway, it is a pretty secure platform. But,
as it turns out.
I've personally never been in a Signal chat, but I certainly
it's very user dependent.
Very, very user dependent. But anyway, so we have like our Philly Healthcare's group has this extensive network of people throughout the city of Philadelphia and even a little bit beyond, that are constantly communicating and sharing resources. And I think we realized very quickly that there was especially with the ICE presence in Minnesota, there was a lot of healthcare providers that were curious how this was going to, if this expanded to Philadelphia, how was this going to go down in Philadelphia? And also what is happening in Minnesota right now as far as healthcare goes? Because, a lot of times the headlines don't show that. They just show the arrests or the injured or so like the more sensational things. But how is this really affecting the structure of healthcare? Yeah. So
where are people getting healthcare? Are they?
Right.
Probably not. They're not leaving their homes, right?
Too scared to even go outside. You're not going to the doctor.
Yeah. And downstream effects of that, right? So
exactly. So I think we hosted this webinar with two Minnesota doctors. We hosted this webinar to share with healthcare providers in Philadelphia, what things are like on the ground for healthcare providers in Minneapolis and in Minnesota. And we got an overwhelming turnout. I think there were maybe close to 300 people on the webinar throughout Philadelphia.
Wow.
Showed up to hear these doctors speak. And it was such an incredible event. And I think, we went through not only what their experiences were, and we provided like Q&A, but we also provided a lot of the basics in terms of what you need to know if like ICE or immigration does, or even federal agents show up at your office. Like this is kind of the procedures you should follow, like Mark was talking about, designating
where they're safe versus not.
Exactly,
sort of
like public versus private spaces.
Because who thinks about these things? Yeah. I mean, I feel like
we've never had to think about them.
Something we thought about. Yeah. Okay.
And just to and a quick takeaway, because I know that maybe this was something we were going to talk about later, but I was just absolutely shocked to hear that ER visits had decreased by something like 50%, and clinic visits even more.
That's a lot.
That's crazy.
It's devastating.
I mean, I'm not that surprised at the same time, but like the people that would normally be going to the ER, well, what's happening to them?
Yeah.
Precisely. And again, obviously this is primarily impacting patients, but when you also look at a healthcare system that like, I mean, look at what happened during COVID and all of a sudden all these visits plummet and their revenue plummets.
Yeah.
So, we already have a lot of hospitals that are kind of financially in a gray area, or even
Medicaid cuts are impacting rural hospital and health systems significantly right now. Yeah.
Yep. So I think, go ahead, Mark.
Oh, no. I keep on interrupting. You finish.
I could go on forever. No, but I basically just to say that, all of this has downstream effects, and the healthcare system, as we know, is already very fragile. And it could take, and again, who knows, maybe there are even hospital systems or clinics that have closed in Minnesota because of this. I don't know that for sure, but I think it's certainly possible that if these efforts expand, that is something we could see happen.
Yeah.
Wow.
Yeah.
Yeah.
No,
Mark, go ahead. What were you going to say?
Yeah, well, kind of like two things kind of popped up. So, one, I can't stress enough, one of the most important outcomes of Philly Healthcare's was it created a safe space for us to have a discussion about these topics, because, we live in a day and age where you don't know who you can talk about these things and how people are going to respond. And I think, granted, I'm from Philly, so I think it's the greatest city in the world. And I think Carrie would agree. You have a lot of really passionate people who want to advocate for their community, and people felt lost. So being able to bring people together so that they could raise questions and feel comfortable about and get answers from some of the experts in the field. Like, I'm getting chills just kind of thinking about it. But, the questions that come up, are questions because they're asking it because they don't have other people to ask. And now they do, a message will come through to say, hey, ICE is 2 blocks away at my health center, letting people know like where they are. So it's this group of people who are now together, and it's really been a great way to kind of support each other. Because especially, we need to then go out and take care of people, but we also got to take care of ourselves first. So I think one of the great things about this group has been able to kind of bring that support, bring the information that they're looking for, because depending on where you are practicing, you may or may not get it from your institution, because you may have different beliefs in your institution. And I'm not saying one is right or wrong, but we want to be able to try to support everyone that's on our page.
Exactly. Yeah, I think a great example of that was when we started seeing a lot of access to transgender care be affected. And the thing is, again, these aren't updates that they post on their website, right? So like if you go to the places that are typically providing transgender care, they're not saying, hey, here's the status, so like, but in the meantime, you have patients who aren't able to access care. And this having the extensive network that we do within Philadelphia, it's like if we don't have the gender affirming care clinic, we probably have someone that knows what's going on, or like it's basically like kind of an underground information network, so we can all stay abreast and funnel our patients to be able to get the care that they need where it's actually being provided, because again, things were just changing so rapidly. And I think that's probably the best example I can think of. That's the power of having a network, right?
Yeah.
It's essentially, that's what we have established. We've established a reliable network of key leaders of healthcare in Philadelphia that are all able to communicate together and share information.
And
That's a great concept.
Yeah, and I have a question too. And just thinking about this, because as you were talking about, particularly like gender affirming care, right? State by state, it varies, right? Some are more supportive than others. We actually just did an episode with a mom and her son who transitioned, and they moved from one state to another state that was more supportive. And he's a 17-year-old going through that, but like every state's different. So how do you manage that in Philly, particularly because you've got PA, New Jersey, Delaware. I'm from New Jersey, so I can say PA, by the way.
I'm from Boston. So
Yeah.
sister cities.
Oh, you
To
didn't
East
tell me that
Coasters.
before we started this. So,
I've been in Arizona for over 20 years, so I don't
Yeah.
think it really
okay.
counts anymore.
All
And
right.
and no offense, I'm from North Jersey. I won't hold that against you guys.
Okay.
My neighbor and one of my best friends is from Philly, so we have this like ongoing fight, like screaming at each other over our fence about what you call, certain words, North Jersey for anyway.
How
But
do you say water?
yeah, water.
Yeah.
Yeah.
Don't
Pork
get me
roll
even
versus
started.
Taylor ham.
Yeah,
Taylor ham
exactly. I
pork
mean,
roll.
that's a whole thing, guys.
Yeah.
But anyway,
I used to say water.
knowing that Philly borders, right? You've got potentially people coming in right over the river, the bridge, right? Getting care. How do you deal with that when you have different state by state rules, particularly like in gender affirming care? Or for that matter, Medicaid, right? Because every state I know a lot about Medicaid, and I'm sure probably if you're not serving immigrants, you're serving lower income Medicaid recipients through the same facilities, right? Like, and so there's a lot of crossover there. So how do you deal with that in a very like geographically diverse and, culturally diverse, um, you know, population?
Yeah. I mean, I think no one has all the answers, but to Carrie's point, we have this group of people that not only reflects probably every single specialty of medicine, but is also at multiple different levels. So if a question is raised to the group, if someone doesn't have an answer, I can guarantee you they know someone who can then get the answer. But
Okay.
honestly, it's that's why we've brought on lawyers to answer some of the legal questions. Now with everything, we've had big discussions about the different welfare benefits. So the social worker that I work with is hopefully going to be hosting a webinar with one of our lawyers in a couple weeks to talk about benefits, because we recognize this is a question. In the same way when someone comes to my office, I know what I can do, and then if you really want to address the social determinants of health, you have to work in a team, right? And the healthcare provider, their physician, like they are one kind of small piece of that team. Like I use a lawyer, I use a social worker, I use a community health worker. So we've now brought those individuals in our group so that when there are questions that are asked, that the physician is maybe the last person who would have that answer. We are able to bring in like the right people to kind of answer some of those questions. It's that same, we're continuing to pivot based on what are some of the questions that are on people's minds. And it's allowing us to kind of then build this group, even though once it started as healthcare providers, it has grown to people that are really caring for the community in a number of different, and not even all of them are in healthcare settings. Some of the lawyers may be part of institutions, others are not, but they're interested in this work and are able to help us. So I think that's probably the best way we can do it. Carrie, what do you think?
Yeah, obviously it's a lot to manage, and we don't have the answers to every scenario. But like Mark said, I think usually we know who we can reach out to, who can get the answer, even if we don't have it right away. And I think our efforts have primarily focused on Philadelphia to start, but I think now we're starting to see growth even beyond Philadelphia. Like we had some people from Lehigh Valley reach out to us.
Oh, wow.
I don't know specifically from we probably do have a lot of people from Delaware already, but I think and actually one of the things that we focused on a lot was the close. Oh my God, the close of Crozier Chester Hospital. Sorry, that like tripped me up.
That's a mouthful. That's like a riddle.
Which one of the major hospitals in the Philadelphia area, and there was a lot of, and still is a big concern about where those patients are getting care. And really, we're all coming together to try to do the best we can to get the answers to these questions and see, is there something we can set up to help these people get care? I think we actually looked into at one point providing care, but realized there are networks in place already, and a lot it's just connecting
Getting
the
them
dots.
there. Yeah.
And there's, I think one thing that was brought up in the webinar is like the possibility of telehealth services, and, like, could you, or home visits for patients who might not be able to leave their house. And, I think the takeaways from the Minnesota clinicians that we spoke to is it usually doesn't make sense to form a whole different system to do that, but you work within the systems to help them expand what they can already do. And so, definitely that was a big learning point. But yeah, I think like the nice thing about this group of people is no one's coming in trying to say, oh, we can do it better than you. We're trying to say, how can we help get patients the care that they need using the systems that already exist? Or if a system doesn't exist, then maybe we help to think of how we can create or help create that system. But in general, a lot of what we're doing is just making those connections.
And it sounds like you built the foundation. Like now that you have, the framework for how to put one of these together, and a lot of that information carries from city to city, right? Like it would just
Definitely.
to do this in another place would just be to find the right people in that place to do the same thing you already know how to do at this point.
Just expanding.
Yeah, you just need to find the champions.
Yeah.
And
it's just finding the people now, and this could be everywhere.
yeah.
That's
And
great.
to be honest, we've actually started to do some of that work because, several of us, including myself, have done kind of collaborative work in this area, like say in immigrant health with a number of different people, like kind of leaders at other states. So kind of talking to other places to say, how can we kind of mimic, like, so for example, the connection through Minnesota was through several of us had some connections there. And we basically reached out to them to say, listen, we are a city that has a lot of similarities to the patient population. How can Minnesota best prepare Philadelphia if we were to see, those changes in Philadelphia with an increase in ICE presence that Minnesota saw? And, you have cities that are like, we're all on the same table. We all want to really be there to help and advocate for our patients.
Yeah. And I think
I gotta
when
keep
you,
them real quick. Keep going.
oh, we're losing Jeremy. This is why the editing and the audio production is so helpful. We'll pause for just a moment. His laptop, he forgot to plug it in.
Oh, okay. Is that going to affect what we've already done or no?
No, it's fine.
No, I just didn't want my battery dying in the middle of the conversation.
I was like,
Okay.
I just realized my battery was getting low.
Yeah.
I was going to ask, or rather, I was going to state too, I think that, we all, as Americans, humans, whatever, like we can all get into our little bubble, right? Like of our lives. And we don't realize that there are immigrant communities all around this country that have often came as refugees. So I think it's Afghans, right, in Philly that are really high. We've got Somalis in Minnesota. We've got, there's which ones are they? Oh my, I'm going to forget it now because St. Louis has a whole community. I want to say I don't know if it's Croatians or they're from Ukraine or.
Yeah, it's really any big American city now will have some kind of pockets of.
Because they create these refugee communities when they're fleeing from war or whatever it is, right? And I think we tend to forget, like there's a lot of these cultural communities that are showing up in really different ways, right? Or here in Arizona for example, we've got many Mexican immigrants that come across the border.
A lot of Hondurans here.
Yeah. So, how do you, and of course I deal with this like in my career too, is like understanding like population health, from one region versus another, because you're going to have, a high propensity of diabetes in one area versus sickle cell in another, right? Like in Maryland, because of a higher, African-American population. There's all these things. When you start to expand, right? Like, and I'm like visualizing this, like it's almost like AI, right? Like all the lines are starting to connect like across the United States.
Are you seeing the Matrix?
I am seeing the Matrix. Yeah. It's like the spider web of like, this is just the beginning, right? Like this can exist in other communities. I mean, you're already talking with Minnesota and giving them some really great advice, right? And you're not even technically there yet. So
and vice versa, it's already going both ways because Minnesota's helping Philly prepare in case it happens there.
Sure. Yeah.
Yeah. I mean, but I think the United States has been built on, having, immigrants come here and, build this country. I mean, the term refugee was not actually formalized until 1950 after World War II. But really a refugee is anyone who's had to forced to flee from their country due to persecution. So anyone who's had grandparents or great grandparents who may have come from other parts of the world that were forced to leave to come here, they came here as refugees. The term may not have existed. Albert Einstein was a refugee. He came here before the term came, but Steve Jobs, who we're all using, Apple, like his family came here as refugees. Like, one of the co-founders of Google was a refugee. It goes on and on. And I think many stories of, you have numerous cities across the country where, the immigrant story is what has made those cities incredible and has helped build the city. I mean, an article just came out, I think in the Philly Inquirer last week, the main reason why Philly's population has risen in the past number of years, the only population that has increased is the immigrant community. Everything else has been status quo. But
I think
everything
it's the same
we
for
have,
the whole country.
Probably.
Right?
Yeah.
And, you think about the incredible roles that these individuals have. And as healthcare providers, like we want to make sure, and as human beings, you want everyone to have access to care. Like that is a basic right that everyone should have. End of story. But that's
Healthcare
not
is
happening.
human care. I say that all the time. Yeah.
And you have people who, but you think about healthcare, you think about education. I mean, I've had so many patients of mine say, when they send their kids to school, they say goodbye, not knowing if they're going to see them again, or they send their spouse to work. The same thing happens. One of my physician, Carrie knows the story, but one of my physician friends in Minneapolis, her kids go to an elementary school with a very diverse population. There's 1,000 kids in the school. For the months where you had the large ICE presence, of the 1,000 kids that were enrolled in the school, between 300 and 400 went to school every day. The rest stayed home out of fear.
Wow.
So, that's happening in education. That's happening, people who are afraid to go to work. That's happening with people being afraid, to go to the doctor when they're sick, to go to the hospital, and, another area that we've kind of worked on as a group is using our voice to kind of speak to elected officials to try to advocate. Carrie and I witnessed what COVID did to our patients. People were afraid to access care. And, I'm in primary care, Carrie's an OBGYN. People were, they didn't have access to care. So they weren't able to take their medicines. They weren't getting their screenings done. And then, COVID passes, and then you have people presenting with advanced disease, advanced heart failure, advanced diabetes, cancer, all of it that could have been picked up if they were able to go to care, but they couldn't because of COVID. And the same thing is going to happen if you're scaring so many communities away from accessing like the most basic human right possible.
And then add on top of that, everybody who's losing their insurance.
Yeah.
Yep.
Well, and even an added layer is that we recently realized as part of there may have been others that knew this, but we just kind of discovered it together as a community that people were sharing. Actually, I think, Mark, it was one of your social workers maybe that shared that she wasn't sure if a patient applying for emergency medical assistance had triggered a, ICE raid essentially. But it seems, and again, I would probably have to verify this, but we have essentially realized that is in fact that they are sharing data. Medicaid is sharing data with Homeland Security. So
where's HIPAA in that?
Yeah.
Wouldn't this be a HIPAA issue though? You can't share people's medical records.
They're not sharing the medical records, but when someone is applying for emergency medical assistance, you have to get information about who lives in your house. Not necessarily, it's not necessarily does this person have diabetes, but there's a lot of basic information that is needed that has to be generated on these applications, which we've been doing for a long time. We're now finding out that this information that is being put in is then being funneled to Homeland Security, and then they can use that to identify, where people's, home address is.
Just when I thought I couldn't get any more angry.
Right.
Oh no.
My God.
So there are now healthcare facilities that we've heard of that out of protection of patients and families, they are no longer, seeing people that require, require them to apply for medical assistance to get care, because if you're doing that, you're putting your family at risk or anyone that's under your roof, and there's not much that can be done about it. I think that the story that my colleague had shared was, it was a pregnant patient who applied for emergency medical assistance, and I think her spouse was here without documentation. He, after the application kind of went through, a number of weeks later, he got picked up by ICE and he's now being detained, and she's pregnant. And when they do their visits, she gets on FaceTime with him so that he could hear the baby's heartbeat, because he's being detained out of state and is not going to be able to come back for the birth of his child. But the fear is there. I mean, I had another patient of mine who came here. Her husband, they're from Afghanistan. They came here in 2021. Her husband interpreted for the U.S. military over there. Came here. They have their green card. They're on their way to apply to become U.S. citizens. She was in the very late stages of her pregnancy, and we were talking about labor precautions. And she turned to me and she said, Dr. Mark, when I deliver my baby, is ICE going to be there to take my baby away? And this is someone who is here through everything is legal about why they're here. And and they're very well educated, and this is their fear. So imagine if someone may not have the same resources from a legal perspective, may not have some of the same education, what's going through their mind.
Yeah, you feel like you don't have a lot of support or resources, which is where I could see Philly Healthcare is really stepping in, right? To kind of plug into that situation and connect you to the right people.
The other thing I would just share too, that was kind of an aha moment for me as being involved in Philly Healthcare, was that, and this is something that was echoed by the Minnesota doctors as well, that a lot of times the institutions and even the public health departments weren't necessarily able to come forward or say a lot as far as what was happening. And I think whether it's for fear of losing their federal funding or, there's a lot of different there's a lot of fear just in general, out there in the community. And even, within Philly Healthcare, there's a large degree or variation in risk tolerance of what people, because again, as we are seeing, these are very different times, right? In terms of what, being even just us speaking about this right now and talking about ICE, could that get us targeted? We know that, DHS is trying to petition Meta to get accounts that are talking about ICE, and, some of those accounts have even been targeted. So, I think we're seeing, certainly, I'm not going to speak to specifics, but the doctors in Minnesota are saying we didn't get a lot of guidance from our institutions. They weren't able to say, this is what you do if ICE, or what you should do to help combat, because again, there's a lot of fear that they're going to lose their funding. And we know that hospitals are cash strapped right now. So I think that's that was a big aha moment that I had. And I think, it's why I think organizations like Philly Healthcare's need to exist to help bridge that gap.
Yeah, I agree. It's really troubling, right? Just hearing these stories, it's those things are happening, and at the end of the day, this isn't good for anybody, right? Even the person that's not the immigrant, the person that is not looking for, gender affirming care, the person, who isn't having a baby, this all affects us eventually.
Well, we're now looking at, like Mark mentioned earlier, this country's always been built by the latest wave of immigrants from the beginning.
Yeah.
When after the very first wave, anyone who showed up after was the new guy, and they had to earn their way. It's just always been how it is in this country. And now we've cut that off. So, and not only are we going to lose that, that kind of lower class labor that we've gotten so used to over this decades and centuries, but now we're looking at negative population growth just when the boomers are hitting the age when they're all retired. We got to pay for them, and we got to take care of them, and we don't have enough people to do it. And we didn't have enough people to do it with the migrant workers and the immigrants who are all here, who are now leaving and not coming because of all this.
All right.
Like,
Absolutely.
how big of a hole are we digging ourselves when,
Well, and the other
like,
thing is, like,
unnecessarily?
it's not even like, I think a lot of times people, and Mark, please correct me if I'm wrong, but like think of immigrant as sort of like one specific definition, right? Like maybe a refugee. But like I think what I've learned certainly in the last couple of years is like, for instance, my husband came from Greece. So he's an American citizen. He was born an American citizen, but he was born in Greece, came here because, again, a lot of his mom's family was here, but essentially he's an immigrant. My own mother fled Cuba when she was 8 years old with the Cuban Revolution. She was a refugee. And now, of course, is an American citizen and has two American citizen children. Like I literally never stopped to think about the number of lives, even within my own, like, again, I'm American citizen. I was born here, but like it was almost like more people than not that were either immigrants themselves or were refugees at one point. I mean, really, this is not like you were saying, this is who we are. This is America. We're all descendants of immigrants or refugee. Like this is part of what's essential to the American story. And so this isn't others. This isn't necessarily like, oh, those Afghan refugees. Like this is us.
Right.
Sorry.
Go back
and you also think about who
four
did it.
generations. Go back 4 generations, and how many of our families were American?
Yeah.
Sure.
Like a very small percentage of people who are now Americans were Americans 4 generations ago. Very small percent.
Yeah.
And if you want to think about who didn't come, many of us have heard about, the story of Anne Frank, right? The girl, the Jewish girl who was killed during the Holocaust. And I read that book in elementary school. Her family tried to come here as refugees and they were turned down.
Wow.
So like that story that many of us remember reading when we were learning about what happened during the Holocaust and World War II, like that story was like essential to our learning. And that's what happened.
Yeah. America is a beautiful place made up of just an interesting and culturally diverse web of people. And, and like I said it before, healthcare is human care, right? And at the end of the day, we need to take care of one another. And
it's,
I mean,
it's the duality of America, though, where we're both a blended culture. And like, you can't deny the bigotry that we were based on.
True.
In a way. But at the same time, we've always been that open place where anyone can come and have a chance to make their way.
Yeah.
So it's it's this weird dichotomy. We have this yin yang kind of mentality with very light and dark sides.
Exactly. And we're always stronger together. We're always stronger working with each other than we are trying to say they're the problem. They're the reason that our lives are the way they are and they need to go. And if they went, then everything would be better. No, that's not necessarily the case. We are always stronger finding ways to live and work together than we are trying to shut people out, in my opinion.
100%.
That's a really great message to end on, I think, here as we wrap up this conversation. So thank you for saying that. I totally agree with you.
And what's the website?
I'm a lover of all. So I'm really, really glad that you guys are doing what you're doing. And I do hope that your model and, this clinical model, this operational model, that it can be scalable into different cities and regions to help more people. 100% here for you to help you do that. We'll be your cheerleaders.
100%.
But really, really great work that you're doing. So glad that y'all came on the show. This has been a wonderful conversation. I hope that it's opened up some people's minds a little bit about kind of, the domino effect of like what happens when we don't provide this kind of care. So, so thank you both for coming on. And also before I let you go, please share with us where people can find you online, social media, this beautiful website that you've built, or even how a provider might want to get engaged with you in the Philly area. Let us know what that is right now, and then we'll make sure to put that in the show notes as well.
Gotcha. I believe our socials are for Instagram at Philly Health Cares. So PHILLYHEALTHCARES.
Okay.
I believe it's the same for Facebook. And then we have a TikTok account as well. I'm not recalling off the top of my head, but
That's okay. We'll find it. No worries. As long as we know what platforms you're on. So
Is the website?
And then we have our website is phillyhealthcares.org.
Philly Healthcare is perfect.
In the show notes.
Perfect. Thank you both for coming on. Again, great conversation, very insightful. I think it's important conversation that we're having, especially in these times. Right now, healthcare affects every single person. I don't care who you are, how much money you've got, where you live. Healthcare is going to show up at your front door and be in your face. And if it hasn't yet, you've been very lucky. But yeah, there's thank you so much. This has been.
Thank you for having us.
Yeah, great.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.